Doctors, they are the lifelines of a nation, the ones who put us back from the brink when life hangs by a thread. Becoming a doctor in India has always been a Herculean challenge as well. Years of grueling study, relentless exams, and long, exhausting internships, training programs, all before even getting a shot at specialization. To become a specialist, the stakes are even higher, as they should be, right? You literally decide if someone can manage your life or not, handle you in that delicate situation in those minutes and seconds that can make a difference. Hence, every mark, every percentile counts, every key information matters. But is that about to change? For NEET PG 2025, the Health Ministry has now slashed the qualifying percentile to record lows. General category candidates who once had to clear the 50th percentile can now qualify at just 7th. 50th, 7th. SC, ST, OBC candidates, including PWBD, can now enter counselling at 0 percentile effectively, no cutoff at all. In fact, if you score minus 40 and are from a backward category, you are still eligible for round 3 counselling of PG. That's your postgrad medical seats. Now just imagine that for a minute. You sit through an exam for 3 hours and still qualify for, you don't even have to actually sit through an examination and still qualify for a shot at specialization. It's hard to know what to call it really. So what's the justification? The government says over 18,000 PG medical seats are lying vacant across India, even as thousands of MBBS graduates wait for a chance. With so many seats empty, lowering the cutoff will expand the eligibility, fill these seats and give already qualified doctors a shot at specialization. The ministry stresses that merit is not being compromised. Admission will still be strictly counselling based. Now, according to NEET PG rank and candidate preference, of course. Now, I don't know how many of us are really convinced by that rationale. A huge number of doctors clearly aren't. They say, is this not promoting mediocrity? Are we not prioritizing seat filling over academic standards? And can we trust the doctors next time we visit them? So, some are even going ahead to say that the quality of future specialists could be impacted if candidates who previously didn't meet the cutoff are allowed to go in. However, it is important to note at this point that revision in cutoffs have happened before as well. In 2023, for example, the qualifying percentile was dropped to 0. In 2024, it was lowered to 5, from 5 to 15 percentile to address similar vacancies. Right? And now we understand that India needs more specialist doctors, so why not? Those are both sides of that story, but the big question is whether lowering the cutoffs is the right way to get there. Is quantity now going to be more important than the quality of doctors that this country produces? That's the big question before us today. All right, to discuss that, let me bring on our guest. Joining me is Dr. Dilip Bhanushali. He's IMM past National President of the Indian Medical Association, IMA as well. Thank you so much for your time. Also with me is Professor Dr. Sanjeev Bagai, Senior Consultant Pediatrician Chairman of the Nephron Clinic as well. Dr. Bagai, let me give you the first word to understand which side of the debate are you on. Do you think that to fill up that lack of doctors and specialized doctors that India needs at the moment, this lowering of percentile is justified?
Good evening. I think this is a complete Mickey Mouse game happening, and it's a bizarre circus of total absurdity. It's time that we relook, reform, reset, and have a complete reevaluation of the way the syllabus has been guided and the exams are being conducted, if at all they need to be conducted. So let me give you an overall preview. We have in India in 2026 going forward, 1.2 lakh MBBS seats and 80,000 MD/MS seats. NEET gives us no conceptualization of neither the aptitude or the intelligence of any student. Overall, if you look at it, any seat which is given as a reservation seat for any criteria, be it financial or socio-economic background or coming from the lower strata of society, especially in a field like medicine, is complete no-no. Look at what the non-merit students are doing. We have one of the highest rates of MBBS dropouts in Indian data. 2018 to 2022, we've had 122 episodes of suicides in undergraduate and postgraduate MBBS and MD seats. We have 1,270 dropouts in 5 years. The dropout rate in certain regions is reaching up to 40%, well above the international norms. There is no science, there is no field of any profession which can be more mentally, psychologically, physically, and emotionally challenging. 36-hour non-stop shifts on alternate days, practically no break. The amount of pressure, fear, anxiety, the
So
amount of
if I'm
academic load
understanding you
is
correctly,
immense.
you are
Now
saying,
you bring a
let me
substandard
let me phrase,
student.
yeah, let me
That's a
rephrase
huge
that.
issue.
From what I'm understanding from you, you're saying the criteria is tough. It's leading to mental breakdown. It's leading to suicides, as we've been reporting constantly as well. But that should not become the reason to just allow anyone. Am I understanding you correctly?
Absolutely, only
Okay.
merit based.
Okay, only merit based. You're basically saying no reservation either. Let me bring in Dr. Dilip Bhanushali on that one. Sir, your thoughts?
Yeah. Good evening. Yeah, IMA stand was that IMA had requested the government in 2024 to reasonably reduce the percentile for the admission of postgraduates. But this type of reduction we had never asked for. 0 percentile. With 1 lakh, more than 1 lakh doctors coming out through almost 7 to 750 medical colleges throughout the country, there was a very need for specialized people in the healthcare system of India. 18,000 seats were not getting filled up. So that's why the IMA had requested that it should be some reasonable amount of reduction in the percentile.
But you are also
And
not
now this
happy with
issue
what's
is
being done.
debatable. Yes. Yeah, go ahead.
That's interesting. That's very, very interesting. Can I ask you, sir, what would you rather have the government do then? Because I see their rationale. We need more doctors. And at the same time, we see how hard the process really is. What would you have rather have the government do here?
So there are 2, 3 things mixed up in this. One is about the percentile reduction of percentile, and how many of the doctors can afford the fees what we have in the private medical colleges. To get a PG seat, the amount of money required is horrendous. So how many of them are able to pay this capitation fee for getting into post graduation?
How
That's
much is
number
it,
one.
sir? Give me a ballpark.
Hello.
Yes, sir. For our audience, sir, if
So
you could tell us how much is it, the PG fee?
it depends upon which specialty you are taking. Some of them are going in crores.
Oh, I see.
In a private medical college, some of the seats are going in crores. So how many can afford that? Now, on one side, we require postgraduates because my other panelists have definitely said that so much of burden and so much of test stress is there on the residents because we don't have residents in the medical colleges, in the hospitals. We want to fill it up. We want to fill it up with specialists, and for that we had requested, in fact, that to bring down the percentile. Now, the capping of this capitation fee should also have been thought by the government, which is they haven't mentioned anything on that.
I see. So from what I'm understanding from you, Dr. Dilip, is that we need to get to the root cause of why these 18,000 seats were empty. Percentile might not be the answer for that, might not be the only reason why these seats are empty. That's what you're saying. I take that point. Dr. Bagai, you want to add to it?
You see, the full system is lopsided. The maldistribution of seats in medical colleges all just so overt. More than 70% medical colleges are concentrated on 30% of the population, which is South India, in 4 states. The regional difference, the language barriers when a young student is entering. This is not a corporate job. The basis of medicine is history taking. The art of medicine is understanding the soul of the patient. If there is a language barrier, there is a regional barrier, it's a huge problem. We are not looking at the mental status of children. We are not looking after the mental health of children. Therefore, the suicides, they can't cope with the pressure. There is no line like medicine. It's tough, it's enduring, it's challenging, it is extremely stressful. Would you rather have the best fighter pilot flying your Rafales in a moment of crisis, or someone who can't fly it that well? Would you rather have your open heart surgery done by the best surgeon, or someone who's going to open the heart and say, now I don't know what to do? We need the best. There cannot be reservations, and NEET is not a good criteria for selecting the best.
Not a good criteria at all. But, you know, Dr. Bagai, I've often sort of riddled with this question myself. You know, when I grew up, millennials like me, when we grew up, becoming a doctor, becoming an engineer was said to be like the highest standard. When I talk to kids today, I'm not seeing a lot of people excited to be doctors anymore. I'm not seeing a lot of kids saying that this is what I want to do. So, systemically, something has gone wrong that has deterred this current generation from this noble profession of medicine. Is that correct?
Absolutely. You know, I'm 60 years of age now. You know, as a senior citizen. When I joined medicine in 1982, there was a beauty, there was a romance with medicine. There was a love to do medicine. It was a never-ending saga of reading, learning, an unquenchable thirst to learn more. This present set of students, especially from the reserved category, are not meeting the cut. The real issue is capitation has destroyed medicine. Private medical colleges are killing the medicine. There's no question about it. Everyone may nod the head, yes or no.
Why do you say that?
That's the reality. The fees for a PG seat goes from 2 to 4 crores. Please explain to me, how does a person from a lower middle class family take loans, sell off their property, mortgage the house, send a child, and then the child drops out or commits suicide or is not able to make a career? It's bizarre. We need to address the core issue. Unless until we don't address the core issue by removing the percentage marks a little bit up and down, your car is not moving, you're trying to push it. That's not the way the vehicle moves.
Yeah, but at the same time, India is also the land for brilliant, some of the best government colleges as well, right? In fact, the world looks at India for doctors. We are not just the pharmacy of the world, we are also the largest talent pool. Indian doctors have made great names for themselves, even abroad. So why is that happening then? And are we looking at India not being a fulfilling enough place for doctors to practice, which is why they move abroad? Dr. Bagai, and I'll come to Dr. Dilip after that.
See, the issue is you spend 6 years in MBBS. That's if you get it in the first try. Very often children take 2 or 3 years trying to give repeat exams of NEET. You take 3 years to do MD or MS. That's if you get it in the first try. Normally children take 2 or 3 years again. Then it takes 3 years of residency and another 1 year or 2 years inclusive of our super specialization. By the time you're a specialist, your goose is cooked. Mine was cooked many years back. That means you're approximately 30, 31 years of age to call yourself a specialist. Your life, your youth has already been sacrificed. That must have value. What I'm trying to say is, when you are doing medicine, you should carry the honor on your sleeve. It's not another profession. This is our life. For me, a patient is a living soul who comes to me because the person is in pain. He's not a disease only. He's not a bed number only. That's why the romance of medicine is important, not multiple choice questions to gauge who's good or not. That's ridiculous, ridiculous, ridiculous.
Yeah, fair point. But Dr. Dilip, I'm just playing the devil's advocate here. We are talking, in fact, having this discussion on a day when Elon Musk has said that the world will not need doctors only. He has said that they will not even need surgeons, robots will take over, his company Tesla is making it. So perhaps, I mean, I'm just playing devil's advocate like I said, maybe the kind of doctors we need for the future will require a different skill set?
So with this, we should not compromise on the quality of the doctors. This definitely on that. We are totally agree on that. The quality of doctors should not be compromised. But my say here is, see, suppose he gets an admission. There is an exam for that before he passes his MD, MS, or whatever super specialization he is doing. Just getting admission with less percentile mark, that doesn't mean he has become a specialist. He has to appear for the exams. That's where if you are not capable of doing it, you will fail, and then you can't practice that.
Got it. Got it. Dr. Bagai, I want to get to the heart of the issue again and help me understand, and even for our viewers who don't understand the process very well, could you explain to me why at the UG level we don't face the problem that we face at the PG level? Why is that happening? Why is there always seats and more people than the seats at the UG level, but 18,000 vacancies at PG level?
So the story goes back many decades back, but to cover a many decades story in couple of lines is to fast forward. We have increased our MBBS seats by more than 110% in the last 10 years. So kudos to the BJP government at par. We have increased our MD/MS seats by almost 90% in the last 10 years. So kudos to the government. But the core issue still remains unanswered. The selection of students needs to be relooked and revised. If you are going to base an entire career of a child on multiple choice questions is wrong. That's not medicine. This is not a finance game. If you're going to gauge an entire career of a child on capitation fees and private medical colleges, wrong. Out of 1.2 lakh MBBS seats, only 50,000 are government seats. Where do the other students go? And what happens to the students who do not do well in that particular day? So my suggestion forward is at least half the MBBS seats must have a criteria of some weightage for your 12 years of school. Here what you've done is you've reduced the school redundant. You're based it on coaching classes like so many, I'm not taking names, which are complete money spinner, mental wreck ships, so to say. They're Titanics waiting to happen and they are happening. And then a child goes into a pressure cooker for 9 years plus 3 years, 12 years. And then you produce a half-baked doctor. No way forward. That's wrong. We need to ask serious questions. The only way to address answers is if you address the core issues. If we hide that and we keep fudging with numbers 0 or 2 or 5% up and down, that's not going to make us go forward. About the AI is going to help us. It will never replace us. Never. It can't happen.
All right, Dr. Bagai and Dr. Darwin as well, thank you so much for joining me. And that was insightful. I've learned quite a bit from what you're saying. And what I'm hearing and gauging from both of you is the fact that, yes, there are problems and yes, there are reasons why so many PG seats are going vacant. But bringing down the percentile doesn't seem to be the solution over here.